I was diagnosed with catatonia. I was delirious, confused, regression dementia. I didn't know what was going on. We had tried everything else, meds, therapy, chiropractic work, ketamine treatments, and nothing was working. So finally we ended up deciding to try ECT.
ECT is a procedure that was first developed in the 1930s and has been refined over many decades to reduce side effects and to improve outcomes. It's used for depression, bipolar illness, psychosis, and catatonia. We're inducing a very brief seizure under general anesthesia to affect brain changes that will help depression and other illnesses.
Stigma is a problem where ECT is concerned. However, there is a big mismatch between reality and the basis of the stigma. So the reality is that ECT is painless, it's quick, it's highly effective, and it can be life-saving in many instances.
ECT has changed George's life. He was unfunctioning completely. He would cry and hit himself in the head for hours and hours straight, and nothing you could do would help him. You just couldn't console him. So it was a horrific time period for both of us, because as a mother, not being able to help your child who you are watching suffer and deteriorate before your eyes, it was horrible for both of us. The ECT clinic is amazing. The people here are some of the most caring people you can ever meet. Coming to ECT has become almost like a safe place for George. He knows he's going to feel better, and I believe that he knows he's being very well taken care of.
If you were a patient coming in to do ECT, this is what your day would look like. They check in, the nurse does the intake, an IV is set up, they get wheeled into an OR where they receive ECT. They are taken care by a team from anesthesiology and psychiatry. Your IV is already set up, so in rapid succession receive light and very quick acting anesthesia. At that point, the psychiatrist along with their team will induce a seizure. There is a set of paddles which are placed either on two sides of your head, or they might be placed on one side of your head. Those are the two common placements known as bilateral and unilateral. Your seizure takes about 30 seconds to a minute or two. Once that's over, you slowly over minutes wake up. And I would say that it takes no more than about 5 to 7 minutes. They're assisted during their recovery. The whole procedure is over within a few minutes, and usually within 2 to 3 hours you're ready to go home.
So it's been about a year since I first started becoming ill. It took like 9 sessions before improvement was noticed, and I've really noticed it after the last couple of sessions. ECT has improved my life so much.
The most common side effects of ECT are headache or nausea. The issue that patients are most concerned about tend to revolve around memory side effects. One big issue that patients worry about is short-term memory and what's going to happen after their treatment course. But in fact, the short-term memory side effect that does happen during the course tends to ease up and dissipate over a matter of days to a few weeks after the treatment course is completed.
My side effects were pretty minimal. Occasional headaches right after treatment, and did have some disorientation. More recently, the past couple of treatments, I've noticed my memory is getting longer. I'm more confident, more motivated, happier. I laugh a lot. That wasn't the case before.
To be able to see somebody get better, a young person be able to go back to school or go back to their job, to do whatever they need to do and function in a safe way, that's the part that I would say that it really is a game changer.
ECT has changed my life. It saved my life. Honestly, I feel better than I've ever felt.
Prior to ECT, George had zero quality of life, zero. He now is able to go to school and he's able to participate in social activities. We lost him for a while and it gave him back to us.